Okay, hello, good evening. Today we are going to give a short orientation about MRCS Part B. Hope I could help you as much as you can, as I can. Let's start simply with this one. Okay. Is it clear to see the shared image?
Yes.
Yes.
Okay, so MRCS OSCE exam or Part B exam. Actually, it is mostly an oral and a clinical exam. Different completely than Part A. Part A is a written exam or MCQ exam. Before even it was an MCQ and MQ, but now it is only MCQ. You have two sets only, one 3 hours and one 2 hours. But in Part B, it's completely different exam. Okay, we are talking in Part B about what's called stations exam, which is formed from 18 stations till the last exam. Okay, and still till this exam 18 stations, but with different types of exam inside the 18 stations. What is the mean of a station? Just this is a 10-minute conversation, whatever it is clinical or practice or just knowledge, oral exam. This is simply, and we will clear exactly this type of station according to the question and the knowledge and the clinical exam few minutes later. Okay, you have two main partitions, two main sections in MRCS Part B exam. You have what is called the knowledge section, and you have what is called the clinical skills section. Okay, knowledge section is mainly formed by three parts: anatomy, and we should be well trained for it in Part A. So it is a big partition, and it's all the knowledge are 8 stations from the 18, by the way. 8 stations from the 18 is the knowledge part. Mainly the anatomy. We have anatomy part, we have pathology part, and we have what is called applied surgical science and critical care. Okay, applied surgical science and critical care. Anatomy, it's easy. We should be full trained in Part A. No difference in anatomy except in some more data, more details. By almost 80 to 90%, it is repeated because anatomy has no more inventions. So I say it's like facts. And almost all anatomy stations, the 3 anatomy stations, are the most stations you have to achieve the full mark in these stations, and it is the easiest station to achieve the full mark. Okay, you will find almost all no new questions, and every station is from 20 scores from 20 points or 20 degree. You have to have all the 20 points in this station. Okay, this according to anatomy. The second part is the pathology, and for some it is mostly, I say it is the silliest part as Part A. Pathology is the silliest part, as part A. So you have only 2 stations in pathology. Everyone is also full mark is 20. And this is, sometimes you can get the full mark, by the way, but when you miss marks, mostly it will be in the pathology station. Okay. The third part is the applied surgical science and critical care. And it's also 3 stations, 20 marks. Actually, it is a mix between physiology, basic surgical science, and critical care. A mix. If you find a station, a full station, he can ask you about physiology of any problem, okay, of blood pressure regulation or something like this. He can ask you about basic surgical science, okay, when to do for this patient operation, when to do conservative, when to do exploration, when to do laparoscopy, and something like this. And the third part mixing with this is the critical care, and this should everyone know it as a basic surgical critical care. He will ask you about metabolic acidosis, metabolic alkalosis, hyperkalemia, hypercalcemia, and how to manage as a surgeon. And you should know the basic management of all these. Even he will ask you about maybe you have a patient in your clinic and you are preparing him for surgery and he's hypertensive, or he has a cardiac problem, or he has a hematology problem, and you should manage this patient. He don't want you to manage it completely. He just wants you to know the basic of management, this patient, and how you direct this patient and to whom you should direct this patient. Okay, is it clear till now? Dr. Bishoy, keep open your mic and just if something not clear, you can tell me to clear it or illustrate it more. Is it clear now, the knowledge partition?
Until now, it's clear and promising.
Okay. If you want more details about, maybe you have some more details about these stations before we finish them. The anatomy stations, mainly, you can find many different ways in asking. Mostly, you may find skeleton. Okay, maybe just, it is not a real skeleton, but a skeleton, plastic
Model?
skeleton or model. Yes, exactly. And he starts to ask you about some attachment, some points, or what is the name of this, or what is the name of this bone, what is the name of this spike, something like this. A point for me about the 7th cervical vertebra. What is this point? What's attached here, and something like this. And all the station, by the way, the station is about 10 to 15 questions. And just put in your mind, you don't need to have long answers. Most answers are 1 or 2 or 3 words, because you have in the station, every station is 9 minutes. Okay. I have to tell about this. Every station is 9 minutes or 10 minutes actually. 1 minute you'll stand outside the station, you read the stem, what's called what will you be asked inside the station. So you can find a paper written in front of you, or at the entrance of the station. You now going to see a patient has hernia, and he is suffering from mitral heart disease, and he is on somewhat of medication, and his age is like this, and you are going to manage this patient. Okay, and then you go for the station in the 9 minutes. Okay, all the stations in the knowledge section will be complete 9 minutes, you and one examiner. Rarely you find two examiner, and somewhat it's just a supervision, but it's mainly one examiner who will ask you and one examiner who have the correction sheet. Okay,
Okay.
every word, every question, you have only 1 or 2 words to answer. What is the attachment here? What is the name of this? What is the action? What is the effect of injury? And he just wants you 1 minute. By the way, the 9 minutes will pass as 1 minute or 2 minutes max. You just enter the station, start asking, don't waste your time. Don't waste your time in thinking more than 20 seconds about an answer. If you find you don't know the answer, tell the examiner, please skip or pass. Okay, so you finish all the questions you know. You may finish in 6 minutes, and then you can excuse the examiner. Okay, can I go back for some question I didn't answer? Most examiners are benign enough to do this. By the way, all examiners, and this exam is fair and benign enough to pass. Fair and benign enough to pass. Anyone tell you this is a hard exam? Really, it's more easier than part A. And the rate of passing of this exam is much more higher than part A. Even me, I have many friends that didn't pass part A within 2, 3, 4 times. And then they passed part B in the first shot, the first time. Okay, so keep smiling that anyone pass part A. Really, it's very easy to pass part B, and it's from our main work, so it will find it easy to study. Okay, if you start to put that is clinical work, and you have to know by your heart, not by your mind, really you'll pass this exam easy. Okay, let's back again for the anatomy. So you have 9 minutes. The examiner will ask you about some question. Okay, what is the other than any plastic or plastic skeleton? You can find real bone. Sometimes even as in my exam, I have some vertebrae, and he started to ask about attachment of some ligaments, some muscles, and how you know this vertebrae and what is the difference between this and this. Okay, you can find any other bone, whatever. The third thing, you may find pictures, some photos, but it's clear photos about maybe some diagram or a real specimen. Photo about a real specimen, and this is the most common. Okay, and he started to ask you by pointing some criteria about this specimen. What is the name of this? What is the name of this? What's the effect of injury, or what happened? What is the action? Maybe this muscle or this nerve. What is this affection? The effect of injury of this nerve in the neck, maybe. What is the name of this gland? What's this nerve supply? What is the hormone released? And something like this picture. In rare centers, and I think it was in Cairo before, and some centers in maybe in UK, you can find a real specimen, a real cadaver specimen, heart, liver, okay. Okay, Dr. Shari. Liver or something like this. This is according to the anatomy. You can find a specimen, and he just some threads, or he just point, what is the name of this? Can you put it, please, in the anatomical position? Sometimes you have 2 bones, 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 2 maybe like Redis and Alna, and he tell you, please articulate this for me, or clavicle and humerus, please articulate this in the anatomical position for me. So you should have, you should know how to do this. This according to the anatomy. The anatomy, by the way, any source you can start to study anatomy, no special sources. Mini books are provided in the Facebook groups by old candidates that they start to recall most questions they asked about. And for anatomy, it's the easiest source you can do, because no change in anatomy from one source to one source. Even some pictures you can find it from two main books I think I heard about. Netter's Anatomy, Atlas of Anatomy. You can find it, and some others like Macmillan Anatomy, or any source of anatomy you can start with, because start just with any source of anatomy, study the main topics you studied in part A, and start go for recalls. It is provided in all groups, Facebook groups, in all Telegram groups. Many recalls are for free. You can go for it, and you'll find questions that's mainly by 90% repeated every year in every center, in every exam. By the way, exams of part B almost every month, but in different country. If you are talking about Egypt, you can find it in March, in September, and sorry, in March and in November. Bahrain in October, and in March also. Many. If you go for the exam times, you'll find every month you'll find a country that have this exam, by the way. So you can choose between many countries. You need to study from 4 to 6 months. So you can find it in many countries, by the way. Okay, Dr. Bishoy, تفضل.
May I ask you, regarding the anatomy, would you suggest
Yes.
that we start studying the recalls of the stations directly, or start with the textbook? Because in part A, I found lately that sticking to questions of the main banks and recalls are the main stem of the exam. But regarding
Yes,
MRCS,
exactly.
but in MRCS part B, I'm finding that I have to do some text work besides the records of the stations, or we can stick to the stations questions.
Recalls by more than 95% by recalls. And by the way, recalls are covering most of the anatomy. It is very rare to find recalls, keep on recalls, repeated exams.
I get the records beside me, and then I look for a picture for this record, right?
Google pictures, Googling your anatomy is the main in your study. Is the main in your study. Keep Googling everything. In the exam, you will remember what you Google about. Okay? Anything you can't understand, just keep a picture from Google to understand it. Try especially anatomy. Anatomy, anything, you rotator cuff muscles. Just know it by picture. Vertebrae, layers of, yeah.
But I don't have to study an anatomy textbook from
No,
A to Z.
if you have a simple Atlas textbook, you can put it in your, beside you, just to go back for some questions or some topics to understand them. Sometimes you need, by the way, the problem of part B exam, that you have a flying questions, like you will not understand all the, if what you need about, okay, you have a topic in applied surgical science, pulmonary embolism. If you want to start to study pulmonary embolism, you can have 1 week studying. But what you need is applied surgical science and critical care, and what is related to you as a surgeon about pulmonary embolism. okay, about 10 to 15 questions. So sometimes if you have time, you want to go back for a simple article about pulmonary embolism so you can understand, okay? Because sometimes you have a just flying question about diverticulosis, okay? Classification of diverticulosis, okay? How you can, maybe as a surgeon, you can know what is diverticulosis, but to orthopedics, urology, or something like this, how they can know the classification without they know what is diverticulosis. Okay, sometimes you have to read once what is diverticulosis so you can know what is the classification of diverticulosis, and that's applied to all. I can go for ortho, and I found he told me this is a metaphyseal fracture, okay, or epiphyseal fracture. So what is epiphysis and what is metaphysis? So I can go for the bone and I look for a picture. I see the anatomy, or I read quickly what is the parts of the bone, metaphysis, epiphysis, diaphysis, and something like this. And so when I go for metaphyseal fracture or epiphyseal fracture, I can understand what is this. This is the problem of part B. You can have a station of aortic stenosis, about 15 to 20 questions repeated every exam, but it is not covering more than 15 to 20% about aortic stenosis. Sometimes you have to understand what is this, okay? You have to understand rheumatic valve, because he wants to, because of rheumatic fever, the patient have aortic stenosis, rheumatic heart valve. So what is rheumatic heart valve? What happens? Why happens this? For me, I just going to Google image, I write rheumatic heart, and I found like a small algorithm or a small table or a small illustration about rheumatic valve and what is meaning by it, and so I can understand it. Sometimes you will need it, and you will need it for the first time only, okay? If you're stuck for a question and you can't understand it, go back for a bigger image once and you will never forget again, okay?
Okay.
دكتور محمد تفضل. محمد حمدي. Okay, دكتور محمد تفضل. I can't hear you. Okay, let's start questions later, please. Okay, please, just start questions later. I'll open discussion after I finish the short orientation about this. Thank you. Okay, second, pathology. And pathology, maybe, as I told you, this is some tough facts. Tough facts. Nothing to understand except for some stations, if according to your specialty, you find some stations about orthopedics, some stations about GIT, and most stations about GIT, some skin stations, some urology stations. Pathology is a little bit tough, and as we remember from our study in the in our college or during our master, if you finish your master degree or MD, pathology is just facts. 1 + 1 = 2. Is my voice clear? Anyone has my voice not clear?
Your voice clear.
Okay. Okay. This is pathology, and this is the station, the most toughest station, and this is the most, I'll not say the nightmare stations, but it's a little bit disturbing for some who don't like to to just study facts by heart without understanding. But this is the real of pathology. You have to know the name of some genes, some cells composition, histopathology of some tumors, and the questions, as we said, the same like anatomy, just a question, answer, question, answer, question, answer. Try not to stop and try to skip and pass questions you don't know till the end of station, so you don't waste time in the station. By the way, most of us at the end of study before the exam, you will finish the station within 6 minutes, even it is 15 questions. It will not take more than 6 minutes, and start to ask the examiner simply. And can I please, something I missed, I didn't answer. If he's benign enough, he'll tell you, yes, okay, we can repeat another one question you didn't completely answer. By the way, most answers with 1 mark, because little will have 2 marks, but it sounds like if any question just have 2 points to answer. So what is the main types of cancer like this? So even this or this, so it may be 2 marks, or maybe sometimes 1 mark, and if you didn't answer the other one, you will miss all the mark. It is very rare that someone can give half mark or something like this. Sometimes it is written for the examiner to, if he answered the 2 points, full mark. If he didn't answer, he one or just answered 1 point, he will lose the whole mark, even if the question was 2 marks. Okay, by the way, the examiner has no rule in the exam. All the examiners has a paper, especially in knowledge. It is written in front of him, okay, the question and the answer and the mark, okay. He is even he is not agree with the answer, but he should go with the mark paper, okay, the mark sheet in front of him. He should obey what is written inside. So if he want to ask you, okay, what is the name of this gene? Okay, it is kite gene. Okay, he will put the mark. If you didn't answer, he even he put in his mind that it's BRCA gene or any other gene, but he will be obligated by the answer in front of him.
Good news.
Okay, so don't be scared from any examiner. Okay, the examiners are benign, and they just put what is written in front of them. You will not find any examiners that ask you any question outside. Sometimes you find another examiner. For my exam in Cairo, most station I found 2 persons examining me, and I just discovered at the end that one is just a supervisor for the examiner, because if the examiner talking slowly or talking by a difficult way, or you feel like something unfair, you have the right to write to give a complaint about the examiner, by the way. So all examiners are benign. They came just to make you pass. They came for the exam to make you pass, and sometimes they help you. Sometimes they help you, by the way. Okay.
Sorry,
so if you
what's their nationality?
About who? Examiners?
Yes.
Mostly coming from UK, whatever their nationality.
Mm-hmm.
Mostly coming from UK. Most of them or all of them coming from UK. I'm talking maybe from Cairo or Bahrain or something like this. But in my exams, there were Egyptians from UK. There were England. Some were Indian. Some were from India. Some were from Pakistan. This about my stations, all of them: Pakistan, India, Egyptian, and native UK examiners, by the way. So whatever the examiner, that's why some people don't like to go for Asian centers, because sometimes you can't understand their language if you are not used for it. If you are from Egypt or Bahrain or Arabian countries, and sometimes it's difficult to know their language, because sometimes you have to be used for the this type of language they're talking about. Okay. This according to the knowledge. The knowledge is, we talk about pathology, applied surgical science. It's a little bit easier, okay? Some we passed through paper part A. It's more, I like it more. For me, I like it more. Maybe somewhat difficult, but he's talking about facts. You can understand and you can imagine what happened, and you can guess the answer if you didn't study before. He's talking about hypocalcemia, some symptoms, some signs, some complications in surgery. He's talking how to manage a diabetic patient. And at the same time, he is talking about some physiology. So he talking about the physiology of physiology of deglutition, physiology of intestinal movement. Just all of this once a small questions, just a short question you will answer. It is a complete scenario. By the way, every station is a complete scenario, starting by physiology and then go for symptoms and go for critical care, and then some different questions. And sometimes you find some questions in the same station away from the topic of the station. Okay, maybe he's talking about hypotension in pregnant lady, and then he asks you what is definition of hypotension, what is preload and afterload, what is the pathology, how to prepare a pregnant lady in the operative theater. If the patient is getting hypotension, what will you do? What drugs will you give? And then can you, the end question or the last question in the station, can you give me a definition for specificity and sensitivity? This is a station. Okay. Sometimes you can find a mix. Sometimes you can find a mix of station, by the way. You can find questions from other stations. Please, anyone just open his editing? Yes, thank you. You can find mix of stations. So stations are known and repeated every exam by more than 95% of the questions. But sometimes the question may be asked in one station, and you can be asked again in another station. So definition of sensitivity and specificity, you can find it in aortic stenosis, you can find it in diverticulosis, you can find it in hypotension, and any other. If you want to ask about the preload and afterload, you can find it in a station of AF, you can find it in a station of hypotension, you can say it in a station of pneumothorax or cardiac tamponade. But whatever, this is a pool of question. By the end of your study, you can know how to answer this question wherever it's a station asked in. Okay, this is applied surgical science. As we said, this is one examiner with one sheet mark and 9 minutes complete questions you will be asked in short question and short answers. Okay, let's move to the clinical scale station, and this is what will happen in the new criteria which will be applied, should be applied in next October, as they announced about it in the end of February or start of March, before the pandemic situation happened, and they said that from October we may change the type of exam and the range of stations. Okay, and before it was 10 stations. Clinical examination was 10 stations. It was 4 examination stations, 2 history taking stations, 2 communication skill stations, and 2 procedure skill station. Okay, now they discarded one of the examination stations and put what is called pilot station. By the way, last 2 exams, or last, maybe starting from last November, they started to put the pilot station plus the 18 stations. So in my exam, I had 19 stations, by the way, but one of them is called pilot station. And pilot station, this is an what we can name it like a test station, and they want to see the feedback about this station and prepare to add this to the main station in the next following exams. Okay, so it is not its mark, it is not added to the total mark of the exam. They just want to know how could the candidates answer new questions. And by the way, not all the questions are new, but more than half the question, or than 50% of the question will be new. Yes, Dr. Bishway, تفضل.
So you confirm that the pilot station, there is no mark on the pilot station.
No.
Do you
Pilot
know
station, yes.
inside the exam, do they tell you it's a pilot station or it's among other stations, and you discover it after you finish your exam?
I discovered after I finished an exam, but I know during my exam, because you go for a new station. We have in pathology and physiology and examination, we have a fixed schedule from recalls and from previous exams. We know. So even in exam, even we can talk about March exam. Shoulder examination wasn't asked in Bahrain or in Egypt, or most exams maybe in UK and Ireland. Sometimes shoulder examination is a station, but we found that they added it in the exam. So you will be surprised by a new station you didn't study before. So it will be somewhat a surprise for you, but after the exam you will discover. For me, I surprised by a station of liver cell failure and hepatocellular carcinoma, and it wasn't even in pathology or critical care or so. But I could answer about 50% of the questions, because I tell you, this is a pool of questions you will be asked. Because most questions, he will tell me about the hepatocellular carcinoma, what is the gene, what is the cancer, what is the risk factors, what is the test you will do for this patient, blood test or something like this. So you will find many questions you could answer, but new questions that is completely new for you. And this is very common in the exam, by the way, to find some questions new, but it is not a problem by any way. Okay.
So they didn't tell you. So they didn't tell you this is your pilot station.
I don't know in the next exams. I don't know. Maybe because here we go. I'll tell you about the system of the exam. After I finish this partition, I'll tell you completely about the system of the exam and what will happen exactly inside the exam location, whatever you were. What will happen exactly, but till my exam, until March exam, exams are divided in 2 groups. Group will be examine the knowledge section, and the group will be examine the clinical section, and they exchange the groups away from each other. Everyone will take a break about 15 to 20 minutes, and then will exchange the places. So the first group will go for clinical, and the second group will go for the knowledge. And this is the pilot station. You don't know where exactly it is, in between this station, because you are going inside a circle. So you can start your exam with a pilot station, and you can end your exam with a pilot station, or you can have it in between. Okay, it's clear?
Clear. Thank you.
I don't know the next October or the next exam, inshallah, whatever, wherever or whenever it will be. They will say this is a pilot station, so you know it is a pilot from the start, or they will put it inside so you can surprise, and they want you to act normally. Because if they told you this is a pilot station, so you will not care about answers inside, and for them, so you want to make some study about, or a curve about how you could answer the question in this station. So I think it will be a hidden station in between. Okay, that's why they make it 18, the same number of exams. Okay. So
is it written or also verbal station?
all verbal station. You will write nothing in this exam.
Okay.
All the exam you will write nothing. Okay, so according to the clinical skill stations, you have 4 types of station in this partition of exam. You have examination station, and you should be well trained about this stations about examination. You'll go for a different way of time management in this station. This station is 10 minutes, including 1 minute reading the station outside. So you have a patient inside with knee pain for 3 months, and he's coming for you to examine him. Please check the patient. So you go inside. After 1 minute, you will find an alarm or a ring. You go to the station. You go direct to the patient, salute the patient, introduce yourself, and some protocol you have to be trained about for this patient, and start directly to examine the patient. In this station, you will have 6 minutes doing examination and 3-minute discussion. 6 minutes doing examination and 3 minutes for discussion. The examiner are not allowed to interrupt you during these 6 minutes. He can ask you or speak with you, and you are free to answer or not. But if you find that he is disturbing you and he is wasting your time, and by the way, you have to finish the examination. You should be trained within 4 to 5 minutes to finish your examination, and this should be with an aggressive training with one of your colleagues or a partner. So you have the right to tell him, please, I want to complete my examination without any answer, without any question, and then he will stop and he will complete, and he will talk to you about everything in the discussion. Sometimes he found you friendly, and what he want to ask you in the 3 minutes, he start to ask you during the examination. So what you are doing now? I'm doing this test. For what? For this. Okay. He should ask you this question after 6 minutes, but he take it by friendly to finish the examination with you, and he will give you the mark, no problem. Okay. This is the examination station. Okay, so 6 minutes you have the duty with no interruption, and 3 minutes the discussion, and the discussion mostly by what's your provisional diagnosis, what investigation, what will you do, how to manage this patient, and this is the main topic in most examination station. Okay, Dr. Bashir, تفضل.
Regarding the examination station, the mark is distributed among my skills and the discussion, or the skills or the discussion only?
Complete paper with him, marking sheet with all the criteria, and every step you do, he will give you a mark about.
So it's
Okay.
distributed between my examination skill in the 6 minutes and the discussion station.
Starting, I'll share for you a paper, an example of marking sheet.
That would be
Okay.
great. Okay.
I'll share an example about the marking sheet, starting from introducing, from washing your hand, it has a mark, introduce yourself has a mark, show sympathy for the patient has a mark, everything you do in the station with a mark.
I'm
I
sure
want to
everybody
tell
was
you that,
watching him.
I want to tell you maybe about 15, 16 marks from the 20 is about your skills, and about 4 to 5 marks only for the questions. Okay, sometimes in some stations, it depends on your skills, and you can pass. If you didn't answer any question, you can have 15 out of 20 in this station. Okay.
Good news.
I'll share a paper with the mark sheet and the everything about this after I finish here. Okay.
Okay.
This is according to the examination, and you have about maybe I can't remember, about 20 to 25 examination station. You should be well trained with them. By the way, I just put in your mind that in the knowledge section you have to study, but in the end you have to have a brain memory. But in the clinical skill station you have to have a muscle memory. A muscle memory. Put in your mind, if you studied knee examination or shoulder examination 100 times and you didn't do it enough to do it by heart, like an orthopedic surgeon inside the exam, and with the exam irritability and stress, you will miss more than 50% of the tests of the exam. You have to be relaxed, you have to sleep well, and I'll talk about this before after I finish here about the exam partitions. You have to completely full concentrated and well trained. Muscle memory is more important than brain memory in examination. You have to go for the patient, you have to do about 15 to 20 tests by heart successively without stopping. Okay? It's very important in examination and procedure skills. History and communication are the same. All these 4 types of stations, you have to be well trained, and you have to start early as soon as possible. If I want to tell you that you have to start together with the knowledge, so every day at night you have to take 1 station of these 4 clinical skill stations and to read it and try to practice it with your friend till the day of the exam. You will confirm, and you will 100% you will pass the clinical skill stations. By the way, most who don't pass part B fail in these stations, because you know that you can go, you are a surgeon and you can open an abscess perfectly, and you do it every day in your clinic 10 times, and then go for the exam, and during the steps and the protocol for the exam, okay, you can miss about 5 or 6 steps from the examination. Okay, clear this point?
Clear.
So this is examination. You have about 20 to 25 stations. You will be well trained every day. If you take 1 or 2 stations, and your friend, your brother, your sister, your one of your elder kids, you can just train to how to make any examination within 4 to 5 minutes, not 6 minutes. Okay, this is examination. Second one is history taking. I'll talk about the second type and third type of stations together. History taking is if you want to check your ability about information gathering. Okay, here is the Royal College want her candidates to be efficient in gathering information, important information from the patient within 5 to 6 minutes. The same in history taking. You will have 6 minutes to take history, 1 minute outside the station to read the stem, and then you will have 6 minutes to have a full complete history from an actor. An actor, by the way, most in examination station, most of them, not all of them, are actors, and also in history stations also are actors. And he is well trained to do this history for many years, and he is completely perfect in answering your questions, by the way. Okay, so you have 6 minutes to take history, so it is testing your ability to information gathering. So how you could reach at the end of your history to a simple differential diagnosis between 2 or 3 diagnoses. Okay, and the end, the 3 minutes, also he will go for asking you what's your differential diagnosis, how you will manage this patient, what's the investigation you do, how you will treat this patient, or what will you do for this patient. This is the history taking station. Successive questions should be organized in your mind, should be trained for many times, more than 20 times. You practice it with your friend. You have stopwatch, start, when swelling, when it started. Do you remember the size? How it started? Is increasing, decreasing, fever, you have pain, you have pain, you have pain, you have related symptoms in other part of the body, and some you put in your mind 3 or 4 differential diagnoses, and every one from these differential diagnoses have 1 or 2 or 3 questions you have to exclude. And the end of the station, by the way, you can have 1 paper with you writing the patient information, because sometimes you can forget about this at the end of station, because after you finish the 6 minutes, he will tell you, please introduce your case. Okay, so I have Mr. John, 25 years old, complaining of a swelling in the midline of the neck for 2 years, increasing, no painful, no other, no diarrhea, no constipation, by the way, just to want to exclude cytotoxicosis, no palpitation, he's fertile, something like this, no neurological complication, no change in voice, or you have to say within 1. Sometimes he will stop you. Okay, he knows that you completely, and from your answer, he just checking you during taking the history. By the way, in this station, you will find in the next 2 stations, and even in the next 3 stations, you will find 2 examiners. 1 examiner, he checking your medical knowledge, and the other one is called a layman examiner, and he is checking your communication and how you deal with the patient, your language, your body language, and everything other than the medical knowledge, okay? And how you talk to the patient as you're going to tell him, do you take any antithrombotic medication, or you are telling him you are taking blood thinners, so he can understand this. And this is what's called the layman language. You have to put in your mind when taking your history, you are talking a patient that he is not he's not a doctor. So you have to tell him this is a swelling, not a tumor, your food pipe, not esophagus. This all will be put in your checklist during marking your exam. So in history taking, communication skill, and procedure, sometimes you'll find two examiners. So you you put in mind, and both of them will put the mark. So he know during your history that you asked about the diarrhea, you asked about the palpitation, you asked about the tremors and so on. And during the introduction of your case, as a question, you have to take a mark on it. Then he will stop you and tell you, okay, what's your differential diagnosis? Okay, my differential diagnosis, simple nodular goiter or cytotoxicosis or simple nodule. Okay, what's your investigation? I'll do this and this and this. Okay, how you manage this patient? I'll manage by this. This is a history taking station. Okay, so history taking station is an information gathering ability. You want to check how you could gather information to reach a differential diagnosis. You don't want you to reach a final diagnosis, by the way. Sometimes it's completely clear about the final diagnosis, and sometimes you can't reach a final diagnosis, and he don't want you to reach a final diagnosis. But he's checking your body language, your layman language, and how you show sympathy for the patient when you tell me, I have severe pain, or I have severe headache, or I'm sorry for that. Do you want to prescribe for you some analgesics now or some painkillers? Okay, I have flashing of lights. Do you want to make the light more dim or reduce the light in the room? Okay, he will tell you thank you. All this, you will have points and you'll take marks for this. Okay?
Okay.
Clear about history?
Clear.
Okay. Go for communication skills. You have two types of communication skills here. Okay, you have what's called phone communication skill. And you, in this station, you are talking to a doctor or a colleague or a consultant to inform him about a case. Okay. Or you have a real actor. Okay, you communicate with him about a situation. So you are taking a consent for OGD, or you are informing him about preparation for operation, or you're informing him about his case, and you find that he has a cancer, or his child has a splenic rupture and should go for the operation, and you are talking for a relative or a patient directly. Okay. In this station, you have what is called preparatory station. Only these two stations, you have what is called a preparatory station. What is preparatory stations? It is a 9-minute station. You will go inside a room with a complete file for the patient before you go for the station. So this station is actually 20 minutes. Okay, this station is actually 20 minutes. 10 minutes first, you 1 minute read the stem, and then inside the room, you'll find a file for a patient coming to do an operation like hernioplasty, and he has a cardiac problem. You go inside, open the file, and start. The file is big, and I think I could, I have one sample of these files, I think, in my drive. The file is like the normal file you can see in hospital, patient data, admission sheet, investigation sheet, follow-up sheet, nursing sheet, vital signs sheet, fluid balance sheet, medication sheet, progress sheet, and you can find about maybe 10 to 15 sheet inside a file within 9 minutes. You should read all of this, so scan so fast as you can, and you just gather in a paper the positive data about this patient. Because when you go direct for the station, which is whatever the phone call or the patient, you should know background of this patient and you talk to him. So if you are going to talk for a patient in the consultant and phone, and you want to inform him about a patient that have a cholecystectomy in the morning, and now he has bile leakage, you'll go for the consultant in the phone call, which is the next station, which is the same station, but the next part of the station. You will open the phone and you will dial a number written in front of you, and you start to take the consultant. Hello, I'm Dr. Fulan. I am Dr. Ramy, or I'm Dr. Bishoy. I want to inform you about a patient who has 11111. Okay. Are you doctor? Are you doctor? Are you the consultant, or are you Mr. Man the consultant? Yes. Introduce your case. I have a patient with this data, and you have to summarize the full file for the consultant and phone. And then he will ask you what you want me to do. Did you have investigation? What is the last liver profile was? When do you check the urine of this patient? What is the blood pressure of this patient? All this data is written in the file, and you should know it. Okay, so summarizing the file is very, very important before going to this station to start whatever the phone call communication or the direct person communication. Okay, Dr. Bishoy, تفضل.
So regarding the communication skill station, it's all about
Yes.
Presenting my data. There is no study material for this station, right?
In the questions you will be asked about, it is a mix. It is mostly questions of the applied surgical science and the critical care. Most questions. Okay. By the way, this, yeah.
You mean in the file I might find he is hypoglycemic, or his glucose curve is not right?
Yes,
and
he has aortic stenosis, or he is on heparin, and then he will ask you how to manage this patient on heparin, or the patient has hypokalemia. Okay, how you will manage this hypokalemia, or what you did for this hypokalemia. You will find many questions from the first knowledge partition, which is applied surgical science and critical care.
But will this station be concentrated on my presenting skills, or it can change into an oral exam on this patient?
It's actually in the phone call. By the way, communication skills is testing your data giving, by the way. Okay. How to give data, how to perceive data, or how to inform patients, inform your consultant about data. So in history, how to gather data from the patient. In communication, how to give data for the patient, or present data for the patient, or for a consultant, or for a colleague in a short, concise manner that give him the most important points you want to give him. How to present the data. You have some data in the file, how to present it shortly. And this is for our friends who are working in UK, this is real. So you are the ST registrar or something like this in your work, and you're calling the orthopedic doctor to refer a case coming from a car accident, and you did the surgical part, and you want to refer it for orthopedic or cardiovascular or cardiothoracic surgeon. How you give him the data? You yes, how to tell him, who are you? I'm the surgical registrar. What you need? Okay, I have a patient with an open fracture tibia. Okay, did you manage this patient first? Did you make the first aid? Yes. What did you did for this patient? Okay, I did A, B, C, D, airway and breathing and. Okay, so what you did for this open fracture? Okay, I washed it and with saline and put and I give IV antibiotics, and I saline soaked dressing, and then waiting for you. Okay, what do you expect I could do for this patient? Is this patient stable? Yes, doctor, stable. What's his blood pressure? Yes, blood pressure is 110/80. Pulse, okay, fever, good. Did you check his hemoglobin? Yes. Okay, so what do you expect? I think you may put external fixator. Okay, that's the question of the phone call. This is actually an oral phone call, but completely different from the communication with the person.
So, doctor?
Yes.
So we have to tell the right value, or if I didn't remember, can I tell any value, or should I tell the right?
He has a copy from the file with him in the room, in his room. Okay. And you should, by the way, if you did see the value and you can't remember, you have to tell him, sorry, I can't remember, but I can go for the file again and tell you. And you have the right, and besides the phone, you have the same file you did see in the other room, and you can check it with him on phone. Okay? You are not allowed to tell fake data. It is a catastrophe in the exam. Catastrophe. If the hemoglobin is written and you were stressed and you couldn't write it, or you write it in a paper, you have to make your paper organize it before you go. History, name, age, presenting, complaint, labs, and by the way, you have to know the labs by date. Okay, because you will find many labs maybe in 12 in the first day, second day, third day. Hemoglobin is going down, so he will ask you, is his hemoglobin stable? No, his hemoglobin is decreasing. So what you suggest, or what you expect? I expect internal bleeding. So what will you do? I'll prepare blood and grouping and something like this. What was his hemoglobin, last hemoglobin? You can't remember. You can open the file first and answer him, okay, just a minute, I can't remember, or actually I can't remember, and he will pass it. He will pass it, okay? But if you answer it wrong, or you just try to say any number, no, it is a catastrophe in the exam. Okay, he wants you to be clear, because you are talking about a patient and a life of a patient. You are not allowed to tell fake ideas or fake information about this. Okay? Clear about this?
Okay.
This is the communication skills. Phone communication skills, mostly questions will be from the critical care. Most questions will be for the critical care, and it's about 5 to 6 stations, by the way, and you will be full trained about this station before your exam, but you have to do it many times. Talking to one of your friends, if you read it 100 times, and if you talk to yourself 100 times, and if you didn't start to talk with a friend or a partner, really in the exam you will be stressed and you will be confused, and you may lose this station. Okay, the second type of station, communication station, is communication with a person. You have to talk with a person, and it's mostly similar like history stations, but you find data, a full data about the station. By the way, it is a 9-minute station, by the way. There's no questions here. You will go for the complete 9 minutes with the candidate, whatever the patient or the relative. You are talking to him from the start. Hello, Mr. John, I am Dr. Flan. I am the surgical doctor or residence here. today I came. Can I confirm your name and age, please? It's just you have to confirm you are talking to the right patient or the right relative. Can you confirm, please, you are Peter's mom? Yes, I'm Peter's mom. No, I'm his aunt. Okay. Can you tell me about the condition of John or something like this? And you'll start the communication. By the way, communication skills are open, and it depends on your own communication skills and your language and your body language, and how you could answer right. It's not checking your medical knowledge, but you have to say right medical knowledge in a layman language. Okay, you have to speak with a patient and you want to tell him that he have a problem in his spleen. He don't know what is a spleen. By the way, you have two examiners here, doctor who is a physician who is checking your medical knowledge, okay, and you are not just taking fake knowledge. And the other one is the layman language. He's checking your body language. You're showing sympathy. You're answering the questions. How you respect the patient or the relative during talking and you don't interrupt him. How you keep smiling or seriously, or how you show serious when some object you have to tell him. How to break bad news. All these are left for the layman examiner to write it. I think it's about 10 to 10 or 12 to 8. I think the medical knowledge is about 12 and the layman language, it's 8 marks in this station. You will be completely with 9 minutes when this patient talking to him. When the patient start to talk, you have to stop talking, but in conditions, because sometimes you find patients or relatives are talkative and you can miss the station and the 9 minutes finish without finishing your station or all your questions and answers and something like this. So with some respect, if you find him talkative, by the way, and he's intended to do this and he wants to see you how you will manage your station. If you found patient or relative talkative, will you stop him unpolitely or you start to interrupt him by a polite manner? All these actors are well trained to do everything, even if wrong. Sometimes he will shout on you and he wants you to see how you will do this, how you will manage this. Sometimes he will cry. Sometimes he will tell you, I don't want to take to you. I want your manager or I want your consultant, please. How you could apologize for him. Okay, doctor, I don't trust in you, or how can I do this operation? I think you are so young to do this. Okay, and communication skills here, it depends on you, by the way, and you don't have fixed criteria or fixed answers or fixed points to talk. You have a schedule and you have an algorithm to talk about, but you can manage it in your body language and in your own language. At the end of the station, he will assess how you could help this patient to get his idea and to answer his questions and queries completely. Okay, this station is nice station, by the way, and maybe at the end of station he may say thank you and smile. You know that you did nice and good in this station. Okay, clear till now?
Clear for me.
Yes, Dr. Ramy, clear.
Clear about these two types of communication skills. The last one is the procedure skills. Okay, you have about 10 to 12 procedures you should be trained about. Open abscess, taking biopsy, suturing, knot tying, and catheterization and something like this. You have to be trained about this. You have a special protocol you have to do. This is By the way, this is also a 6-minute station and 3 minutes for discussion. Okay, 6 minutes doing and 3 minutes for discussion. You go to do your what you are doing, like suture this wound, how you prepare your equipment, how you sterilize, how to ask for the consent, wash your hand, confirm the patient data, and make sure that the patient, his name, age written, and he's wearing the bracelet, so you are not going to do the wrong operation for the wrong patient. Asking the patient some special questions about every procedure you're going to do, like you're going to make an abscess, he's taking any blood thinners, he has any infections, did he take the analgesia or not, or something like this. And then you go to do as fast as possible. Should be well trained about procedure. By the way, the most confusing stations in the exam is procedural skills. The same like examination. If you are not well trained at home to do this in an organized manner, you will forget in the exam. Okay, so you go, wash your hand, introduce yourself, confirm the patient data, start to sterilization, prepare your equipment, change your gloves, check. You have to, if you are going to do an abscess, you have to check the center of fluctuation, and you have to open the abscess in the Langerhans line, Langer's line, not to open it in any, he will ask you, why did you open this in this direction or in this direction? And then during opening the abscess, you have to give the patient information. I'm going now to open. You feel some tingling. I'm now going to take a biopsy or a culture and sensitivity. It will be within 3 days. You will start an antibiotic. You shouldn't have shower for 3 days. You will remove the stitch after 3 weeks, and so. Everything, this should be done in 6 minutes. And then he starts to ask you some questions related to your procedure skill you will do. Okay, this is according to the procedure skill, and also how to deal with the patient is very important, and everything is written in the correction mark and in the checklist for this patient. Okay, starting from introducing yourself and washing your hand till you tell the patient thank you. All these have marks in the exam. Thank the patient and introduce to help him to dress himself or to get up from the bed. All this is written in the checklist for the patient. Okay. The last one is the pilot station, and I think we told about, and we don't know how they will do it on the real exam. Maybe I think the same should be in between the in the stations. Nothing new, I think so. Okay, I think answered about how the procedural station could be assessed. We have a checklist for this. Okay, this is simply what will happen in the exam. What will you do? You'll go for the exam in the morning, maybe, I don't know, in Cairo, Bahrain, something like this. You will be have your number. You'll take your candidate number you will receive in the email. You will have your candidate number. No phones are allowed. Nothing, even all equipment and or examination equipment are provided there, so you don't allow to do it, except you maybe have one. Even in the station you can find pencil and pen and something like this. You will be divided in 2 groups. One group will start the knowledge section, and one group will start the communication skills section. Okay, you find like a corridor with many doors. He will tell you everyone will stand in order in front a door of the corridor. You have to hear 3 alarms. 1 alarm, you will start reading the station. After 1 minute, the second alarm, you will go direct, open the door and go for the station. According to the station, if the station is divided in 6 minutes and 3 minutes, another alarm, you will hear it after 6 minutes. If you don't, if you are in the knowledge section, you just forget about, but it gives you an idea about the time that you pass. 6 minutes of your time sometimes help you in exam in some stations like communication, that you didn't finish with the patient and already 6 minutes passed. And the last alarm, which is, or the last ring is that your station is finished. Whatever you are doing, you and the examiner, once the ring done, you have to leave the station at once, because another candidate will start going to the station and you are missing a time from the next station. Okay, the 1 minute for the station starts, okay, from the time you leave the previous station. So you go direct, you go for the next door and you start reading the station. After 1 minute, you will find a ring, and so on. Okay, this is what will happen in the exam. You will start with number 1 or 2 or 3, whatever. If you are 10 candidates and they are 10 rooms, so everyone will stand in front one room. So you may start with number 3, with number 4, with number 5, something like this. So you'll start to go in a round turn, 3, 4, till you find 10, and then go for 1, 2, and then you stop. So you finished all your station. You will take a break about 15 to 20 minutes, and then they will exchange you to another, to the other hall for the another turn in station. So you will start your clinical turn the same like this. In between, you have what's called rest stations. Rest stations, you want to make organization, because you have in the communication skills what is called preparatory stations. So in a preparatory manner, you can find that you don't have a station in between. So you call what's called a rest station. A rest station, and you may have 2 rest stations successive. So you can go for number 1, you go for anatomy, and then you have, sorry, this you will find it more in clinical. So maybe you have 1 examination, and then next you will find in front of the door, it is written a rest station, or a chair, and it is written in the chair, it is a rest station. You have to sit, because your colleague is in the next room reading the preparatory station. He didn't go for an actual station, and then go direct for this. Okay, chat. So how the procedure station could be assessed? So one may start with a procedure station. Yes, you can start by any operation in the any station in the exam. Okay, all these exams you put like 18 and you put it in one circle. Okay, and then you are 18 candidates. Okay, you will start. You will stop in front.
I think more than 18, because there is a rest station.
Yes, yes, more than 18 for sure. Because and many rest stations. For me, in my exam, in the first 6 stations, I started with rest. I started my exam with rest, and then go for a preparatory station, and then go for the main station, which is the phone call, and then I took 2 rest, and then go for maybe a procedural station. Okay, so in the first 6 stations, in the first hour, 60 minutes, I just have 2 stations. You can imagine this? Okay, so be ready. The exam is stressful, some stress. You should sleep good the day before the exam, and I prefer that the day before the exam, you don't study, or just in the morning have refreshment for some clinical knowledge, clinical the clinical skills only. The knowledge section, study, revise, stop one day before the exam. You will remember in the exam. You can't revise all the knowledge the 2 days before the exam. It is better to see some videos about communication, or some videos about clinical examination, or some videos about procedure skills as much as you can, and train yourself. Okay, the day before the exam, you just have a toy. If you are in any place and you don't have a partner, you can have a toy, a big toy for one of your kids, okay? And you start to do a knee examination, back examination, clinical nerve examination, like you are talking to a real patient, okay? Or you just have any maquette, and you have a needle and thread, and start to train yourself in knot tying. By the way, in the exam, you will be stressed. So you should be trained in how to tie a knot with one hand, with two hands, how to do a surgical knot, how to do a reef knot, how to tie in depths, okay? All this you should be trained, and you should have a good muscle memory for this. Castration, you have to revise the steps in your mind, when to tell the patient how to sterilize the penis, how to start to put the analgesia, how to or the anesthetic agents, when to inflate with water, when to not inflate. Any step you will miss here, you will lose marks in it. So the day before the exam, you should be completely relaxed, sleep as early as you can, go fresh for the exam, okay? The day before the exam, try to have a carbohydrate load, because the exam may be about 4 hours, and sometimes it's up to 6 hours if centers like Cairo, and many candidates per day. My exam started at 9 and we finished at 4. Okay, all this time we finished 4 o'clock.
For morning Fajr?
No. Started at 9 in the morning and we finished 4. Okay, 9 morning, and we finished 4 p.m. Okay, you are allowed only to drink. Maybe in the break you find some tea, some biscuits, but sometimes in the stress you can't eat. So the day before the exam, just do a carbohydrate load. You can have 1 chocolate. So in between if you have a rest station, you can eat it fast, like any melted chocolate. Water is allowed there. So between you can drink water, but the most important thing, you should be fully conscious. Many of my friends who are perfect and studying good, and they couldn't sleep the day before the exam, and they tried to revise everything before the exam. And as you go for the exam, and after 3-4 stations, you could just going to lose your conscious. This exam is not only mentally tiring, it is physically tiring, physically exhausting exam. Okay, so go miss maybe one like me after 1 hour in the exam, and I only did 2 stations from 18 stations. You can imagine this. After 1 hour, I did 2 stations from 18 stations. I was very confused and I was very irritable. And as you start the stations again, you have to hold yourself, gain your conscious again, gain your trust again, and just don't lose your trust in yourself. The exam is completely. Any recommended clothes? Yes, clothes are written in the paper of the exam. Should wear simple shirt, okay, chemise, and the classic wear. No watch allowed. If you have watch, you can put it in your pocket or something like this, and the arms should be exposed. Okay, you have long sleeves and expose it till the elbow. No golds or accessories allowed. Try to be good smelling. Those who are smokers. You are examining patient and you are talking to patient and examiners, so try to no smoke smell should be allowed. Okay, you should be nice in your clothes, because this is one of the main things that will you will be checked about in the exam. Okay, nice. He will tell you all this in the exam. Good smelling, no smoke, shaving good, just your beard and your mustache, good shaving, your hairstyle, haircut is recently done. Yes, for sure, this is very important. You have to, because they want you to how to meet a patient. You are a doctor, how the patient could trust you. But if your hair is long beard, not well trimmed, you are smelling smoke because you are smoking so much before the exam, and your clothes smell smoking. No accessories allowed, because you are going to do some procedures, so you shouldn't wear any rings or watch, because you are going to wash your hand many times and wear gloves. So no accessories allowed. Sometimes if you want a watch, as I told you, can put it in your pocket, or some people put it in one of the rings of the belt, of your trouser belt as well. That's all I think about the exam. What to do if felt that I do bad at some station. Don't worry about this. Okay, the pass mark of the exam. The pass mark of the exam. You have a wide range of passing by this exam. You have in the knowledge, I think, before I will talk here about 10 stations. Okay, in the knowledge you have 8 stations by 20, so you have 160 mark. Okay, the pass mark is a complicated calculation, and it is different from one center to one center, and different from one day to the other day, or to another day in the same center, by the way. It has many complications and many calculations, and they put it in a curve according to all the candidate answers, calculated in a specific manner, and they put it in Excel sheet and a specific curve that give the what's called the mood of the success rate on this day, and the mood of the success rate on this center this year. Many, but almost all the success rate here is from 108 in this station to 100 almost 13. This is the success rate. Okay, collectively here it was 200, and the success rate was from 128 till 133. This is the success rate in everyone. Okay, this is collectively, and they are not added, and you have to pass in this, and you have to pass in this. If you didn't pass, you will find the result. In part A, he gives you the total mark collectively, paper 1 and paper 2, okay? And then give you the details of every paper. But in this exam, they don't mix the 2 marks together. You have knowledge and your mark is like this, and you have skills and your mark is like this. Here is pass and here is not pass. So you may have here 107 and here you have 156. Here is pass, here is not pass, so the final you didn't pass. Okay, so they are not collectively together, or they don't add the 2 marks together. This is the first point. Second point is this is the collective result for all the station. So if you go for a pathology station and unfortunately you get 0 from 20, okay, it has no problem. If you pass the success mark or the point of success or passing mark, if you pass it, no problem if you have 0 from 20 for any station, okay, because it's actually will not happen by any way, but I say if a station you don't have, you just have 0 in the station and you did good in the next stations, you will pass this mark. That's why I'm always tell you anatomy station, you have to have all the 60 as much as you can. And then you are going to have at least 50 to 55 in all these stations, which is
Hello.
Sorry. Okay. Yes. Sorry. In these stations, you have in this 100, it's enough to get 50 to 55 from this. Okay. The same for the rest of the stations. Okay. You, if you did one station bad, don't be confused. Don't be irritable. Don't be stressful. Go for the other stations and you will go for the rest of the stations and you will pass. Okay, it is very easy. It's very easy to get 135 from 200. It's very easy. You know, here you missed about 65 degrees. You may have 2 stations completely 0 and you still pass. Okay. Clear about the marks of the stations?
Yes, clear.
Clear, I think. Okay. What else? Okay, I can show you some examples about a checklist mark sheet. Just a minute. Clear?
Yes,
Hello?
marking criteria.
Yes, okay, so the image is clear now. Okay, this is the marking criteria For the patient, I think this is for one of the communication skills. This a patient want to discharge against medical advice, and this is the marking criteria for this patient. Okay, so when you go for the station, he will ask you, please, what is your number? Your number will be with a sticker on your t-shirt, okay, with written with a big manner, okay, a sticker on your t-shirt written with a big numbers. He will ask, what's your name? My name is Kaza. Show me your number, and he will write your number here, whatever, like 5032. Okay, this is a station of DAMA, or discharge against medical advice, and he will start to go for you. Okay, you go for the patient, you wash your hand and introduce yourself. You did it, okay, he will put here 1, he will put 2, okay, and then confirm the patient name. If you forget, he will do like this. Establish reason for waiting to leave hospital. If you did it, it's okay. If you didn't, okay. If you just did here 1, you didn't 2, you'll take only 1 mark. Explain for the patient he can please discharge it. If you forget to tell, okay, your health is critically ill and you can't leave the hospital, your hemoglobin is falling, you have a perisplenic hematoma, you have clearly did it, whatever, he can give you 1 or 2 according to this criteria, okay, and he have another layman language examiner, and he, by the way, in every exam there is 1 or 2 supervisors that goes through the exams to make sure that everything is going good and you are taking all the criteria and they are following the criteria of the exam till the end of the patient, and he will tell you overall impression. He will tell pass, borderline fail, and someone here, by the way, will collect the degree of you. Did you take مثلا take 12, take 13 out of 20, and this is the end mark. I think maybe the examiner himself will do it, or another examiners which will revise all the mark sheets to make sure that every point is calculated and added to your time. So even here, summarize your discussion. Sometimes some patient, he will ask, he will give you a mark about summarization. So after you finish, patient, he want to discharge against medical advice. Before he writes the consent, you have to tell him, Sir, Mr. John, I will summarize again what I told you, because if you sign this document, you are sure and you are completely fit and you are completely understanding what you are doing. Okay, so you are critical patient, you are admitted with perisplenic hematoma, and this is dangerous to your life, and you are missing some hemoglobin every day, and you should stay for 48 hours, and you know everything, but at the same time you want to leave. Are you agree about what I said? And this is what the summary. Okay, and if you didn't say, you will take like this and you will miss some points. Okay, is it clear about the sheet mark?
Yes, very clear.
I think may I have another one? Yes, another one here, the same. Introduce yourself, check identity of the patient, maybe this one drug and alcohol history, and I think this is a history, suggest mental health professional review, remain open, non-judgment, complete about the English. Yeah, I think this is post-medical. This is, I think, examination. This is Not should it may be not an a surgical or MRCS OSCE, by the way, but it's the same criteria here. Introduce yourself. You have to confirm the patient. You may start your conversation with a wrong patient. So, hello, Mr. John. Hello, I'm Dr. Ramy. Could I confirm you, Mr. John? Yes, I'm Mr. John. And by the way, this is different between a patient you know in the ward. Okay, because if you ask this question for a patient in the ward or in the operative theater, sorry, at least on the ward, you may lose marks because you answered this. Okay, as an example, he told you, by the way, doctor, you are the resident doctor for surgery today, and you have Mr. John in the ward, and he did a colectomy in the morning, and now he is suffering from a fever. You have to go for him to check him and to take a good history for him about what he is feeling now and about his condition. When you go for the patient and he is Mr. John, who you did a colectomy or helped or assisted in a colectomy in the morning, you go for the patient and you go for the bed and you know he is in ward 4 in bed 8, and then you go for him and tell him, please confirm your name and age. It's completely wrong and it's completely unacceptable. Okay, but when he tell you you are going to consent a patient for an OGD, the patient is sitting and waiting for you in the clinic, and you go just salute the patient. Hello, I'm Dr. Fan. Are you Mr. John, or could you confirm you are Mr. John, please? Yes, I'm Mr. John. Oh, I'm his wife, or something like this. This you have to confirm, and this is with points in the exam and with marks in the exam. Okay.
Okay.
I think one more here. The same. Introduce yourself to the mom and establish her name, relation to the child. This may be the same like splenectomy, communication skill station.
What's
like
in
patient
AI?
parent cam. Sorry.
Sorry, what's in AI?
I don't know exactly about maybe the name of the station. I can't. Non-accidental injury. Yes, exactly. There's a non-accidental injury. This is the. I think the patient with a child with spleen injury.
Child
I think.
abuse,
Or child abuse. No, sometimes establish his normal level, take psychiatric history about. Maybe I tell you this is examples from some criteria and OSCE, maybe not MRCS, but you have the same like this in a station. We have very common in the exam, which is the splenic injury, and you are talking to the parents, and one in the communication also with a patient, a child with appendicitis, and should go for appendectomy, and you have to talk to her parents and to take consent and to explain for them what the patient have. You will find, are you the father, are you the mother? Okay, and then you start to talk to them about the problem, and they will ask you, so she can go without operation? No. Okay, how many days will stay in hospital? How many hours will stay in the operative room? Will this affect her fertility, or any further complication will happen in the future? And you have, with your personality and your communication skills, you have to clear all their doubts and all their questions about their child in a simple manner and breaking bad news. As the same, and again, I repeat, you should tell them they have a problem in an organ in the here in the tummy, and you one of your communication skills in the how you can draw in a paper what is the appendix, or you can point with your hand in this place of the tummy, not the abdomen, because abdomen is a medical term. And they have inflammation in this small organ, which is called appendix, which is a part of the colon, and it's very common in childs. And and so on. And really, it depends on you. You don't, I always trust and I always believe that communication skills depends on you, okay? It's not depending on any fixed criteria, okay? It depends on you as a doctor, and good communication skills you have to know. That's all. Abdomen is a medical term, yes. Yes, abdomen is a medical term. You have to tell tummy. All in the communication and history stations, you will be trained about all terms, layman terms. So you will not say antithrombotic drugs, or you will say blood thinners. If you tell tummy, you have to tell this is swelling, not a tumor. Many things you should be trained about all this. And as long as you can say layman language and simple language for the patient, the more acceptable and the better mark you will have in this patient. By the way, this is a new criteria announced in last February or start of March about OSCE exam. Okay, I don't know exactly what they mean by about patient safety, but here he is talking about with the effect of October. They said the last typical exam will be in September. So starting from October will be changes like reduced number of physical examination station 4 to 3, and this I think we cleared about. Also, number of stations will be 17, not 18, and a routine inclusion of a pilot station will not contribute to the candidate result. Okay. What's not clear till now, what's incorporation of health promotion into the ICBSE MRCS syllabus. I don't know exactly what they are meaning by this. Also, incorporation of patient safety on both anatomy and procedural skills. Okay, I think this will all should be cleared within the next few months, but I think after few days of declaring this announcement, the pandemic catastrophe happened, and they couldn't have time to clear this. Maybe this will be postponed till the next year. I don't know, maybe because they didn't put in mind about the delay in the exam. Okay. Any questions? We can open mics for all. Okay, so now it's clear, so we can end our discussion. Thank you for attendance. I hope I could help you, or I could give you some beneficial data about the exam. Okay. Any more questions you have, you are welcome to ask.
Yes, Dr. Ramy.
Yes, okay, for Dr. Ayman, yes.
Actually, I haven't passed, still I didn't pass part A. So,
yes.
So is there a way to study part A and B together, or
don't
separate?
confuse yourself? No, separate. Part A needs more studies than part B.
Yes.
Maybe 3 to 4 months, but complete different studies. This is mainly written exam, and the other mainly is an oral exam. So no, just finish this and go directly in the first next possible exam.
So
Okay.
the anatomy is different from part A to part B?
No, the anatomy will continue with part A and part B. As long as you are strong in anatomy in part A, it will help you to save time in part B in studying anatomy.
Mm-hmm.
Try in part A to study anatomy as strong as much as you can with illustrations, diagrams, and images, and some atlas books. Keep on atlas books, by the way. You don't need big sources. I don't big illustrations, just an atlas. Keep an atlas. We have in our Facebook group, and I think with Dr. Bishoy, you have many anatomy books with good atlas books, and even in the Telegram groups, especially those who sometimes take from them in the OSCE exam images like Netter and Macman Atlas of Anatomy. Both these, sometimes they take some images from them in the exam. So keep the simplest exam like Atlas exam. Okay, Atlas book. It will help you so much.
Okay.
Okay.
Okay, Dr. Ramy, thank you very much. It was very, very useful information, and it was exciting for the exam.
Okay, thank you. Hope you pass part A soon and go direct. I tell you, go direct for part B. Don't wait. Okay,
Yes.
you will have a good courage and you will be motivated enough to go for part B. I passed both of them in 8 months. I go for April and then direct for November. Okay, so it was so motivating to me to finish it in 8 months duration. It's easy. They are fair enough.
8 months?
And they want you to pass. I finished in 8 months.
Oh, yes.
Part A and part B.
4 months for each?
Sorry?
4 months for each, 4 months?
I started study in February and I go for April and then I go for the 1st of November for part B.
But I think you have examined your master.
I finished my master degree about 7 years ago.
Okay.
I'm fully masterized in 2013.
Okay.
I finished all MRCS in 2019. It's easy to pass both parts together, by the way, in a short duration, and the success rate of part B is much more higher than part A. Okay.
Okay, Dr. Ramy, thank you very much. It was very, very informative Zoom, and thank you very much. Thank you for your time.
Thank you for you all for attending, and thanks for Dr. Bishoy who prepared for this station and for this Zoom meeting. Thank you, Dr. Bishoy.
Thank you.
The next for what? The next station? I think maybe we can organize with Dr. Bishoy for part A, but I don't think part A is needing. Maybe most of us know part A because it has some so fixed sources and fixed types of questions, but maybe part B is interesting to know about the stations because no one, and even if you have to read many in the website for part B, you will not understand except for who's already passed the exam or go through the exam situation, so you can get benefit for it. You are talking, Dr. Next Zoom session, talking about part B. I don't think we don't have, I didn't start to make lectures for part B. We're just going to now orientation, but soon we will start to make a schedule for part B stations soon, maybe in May. I'm just preparing some materials So we'll be ready for the exam in October when they open the exams, inshallah. Dr. Bishoy, تفضل.
Very thankful for your invitation today. I want to make it clear that I did nothing. You did it all. I just asked for your help and you responded very welcome. So happy to know you and to have this conversation with you with all those promising surgeons.
You actually encouraged me, Dr. Bishoy. And if you didn't encourage me and push me to do something like this, I think I will not be ready or something not courage. But really, thank you.
You're already doing it every day in your group. It was very inspiring, really. And
by the way, if someone in part A, we are active in part A because I started about 2 months ago with part A, preparing for April. Then April postponed, so we're still going with part A. If anyone didn't pass part A till now, we have I have many Zoom, about 20 Zoom discussion about many partitions free in the group. Open, anyone can see it anytime for part A, but actually we didn't start part B, but maybe Dr. Bishoy will help us to encourage us to start some
I'm here to learn from you all. Thank you.
Stations for part B. Thank you. It will help. Thank you for live course before the exam. Okay, part B. Okay, I'll talk about this question. It's a very common question in the in everyone. Should I have a course or shouldn't I have a course? Okay, till now we don't have a fixed exam till now. Okay, if you can study by yourself and if you have the material and you can encourage yourself and you can control yourself and study whatever in part A or part B, materials are provided in all Facebook groups and all Telegram groups. All materials 100% and more than 100%. Okay, course will not give you a new information or new box or new data, maybe minimum data, because in course you can find many groups. Everyone has his own data and his own experience, and he didn't, and may he pass 2 or 3 times in the exam and he didn't pass. But if you have an active group of studying, I know many who passed without any course. I know many who passed in any course. But course is helpful, yes. Helpful for those who can't control their study, who don't have any schedule or any table for studying, or they need someone to tell them you have to study this and you have to study this and you have to study this. Course is a time management, not more, like Dr. Bishoy do in his group. Course is a time management. If you have a time management and you go for this time management strictly, times for every part, time for revision, time for schedule, time for practicing, you can go without course. But course will provide you with time management, and he will higher your pass rate, maybe about 10 to 15%, 20% sometimes. But you know, the pass rate in MRCS, it's about 70 to 72%. Okay, so I don't think you go with 50% and he will raise you by 20%. No, he's just raising you and making you stressed. As we say, if something you pay, you will start to study. Even by the way, if you in the exam itself, if you didn't pay for the exam and book the exam, you will not start to study seriously. Courses are good if you don't know or you don't have the courage to do it with yourself. But if you can do it with yourself, materials are everywhere, everyone and with every person, and everyone go for the exam. He published his experience and he published his recalls in many groups in the Facebook and many groups in Telegram and WhatsApp. Okay, so when exams are started to open, and make sure that it will be done in its appointment, you try to think. You need 3 to 4 months to study for Part A. You need 4 to 5 months to study for Part B. To study for Part B, and that's all. I think so. See, just it has individual variation. See what you can do and decide what you want to do. Okay, that's all about courses. Thank you. To make clear, Part B course, it will cost much. Yeah, sometimes it depends on the course materials or what is the course's online course. Many places now are doing courses, even it is face-to-face, online, or in Telegram, or in Zoom, or something. Dr. Bishoy's group, I think Dr. Bishoy can help us and write his group. I think Masters MRCS on Facebook group. He can write in the chat, please, the name of his group. He's a very active group, by the way, on Facebook, and putting a very nice schedule till now for Part A, Masters MRCS. Thank you, Dr. Bishoy. You can search for this in the Facebook group. Okay, thank you. I'll stop recording, not to make it so long.